Good day, everyone. Welcome to my channel, Public Health Teacher. We are all welcomed, okay? In this video, I would like to talk about the COVID-19 pandemic eradication strategies, all right? And I wish to let you know that towards the end of this broadcast, people will be able to observe and understand the reasons why we need to eradicate COVID-19, okay? So let's quickly look at what COVID-19 means and how is moving so fast. In this video, I'd like to say that majority of people all over the world, are seriously and invariably thinking, and they have been asking a lot of questions about when is this disease going to end? When is this infectious disease going to be, a thing of the past? People are very, very anxious to know what is really happening. Why not all these we have been doing? What happened to all the things that we've been doing in the past? So what happened to the effort of the healthcare professionals all over the world? You see, a lot of people are asking several questions, and today we have done our research. We have, consulted and, put a lot of strategies to, communicate and listen to a lot of healthcare workers all over the world to know what they feel, to know how patients are doing, to know people's perceptions about the rules and all the things we've put in place, especially the safety rules, to know how it's going to help to eradicate this virus. And today we've come out to publicly say that there are lots of things to be done, and although we've started, it's not going to end like that. We have to do more. We need to do more. In other words, to make sure that COVID-19 runs away from this earth, go back to wherever it's coming from, we have to do a lot of things right now. We know that coronavirus has become a biological war in this our present history. In the history of man all over, from the beginning till now, there hasn't been any war that has been so far and so worst disastrous like coronavirus. This virus began from Wuhan, China, and we all know how this disease has been multiplying all over the world. It's unfortunate that people didn't know when this disease started and how it is moving. Right now, we say that most times that people who have this disease do not know, and those who are tested positive, you see, not all of them have realized or accepted that they have this disease. And all this we put in place to say that this coronavirus has done great harm to the world. It has caused loss of unemployment. You see, great number of all our adults today, great number of our youth today, we say that they are unemployed because people are afraid. People are running home. People are looking for safety. You see, no one is interested to do the job again. Lots of things have gone too bad. Even the healthcare workers working in their hospitals today, they are very, very afraid of what will come after working for a day. A lot of health workers will say to their family, please, I'm going to work, please take care of my home. You see, that means they don't know what will come out of their daily job. We say that this COVID-19 has just put debt to everyone. It has just caused a lot of huge debt to different companies all over the world, especially those who have their daily income to make sure they take it to do special things like investing it and all that. But so long as so many people are not working, people are not moving, people are at a place, you see, the virus has caused people to be at a stagnant area that no one knows the next step to take. And right now, all this has happened that the healthcare workers all over the world have done their research to say, what are we going to do? How are we going to eradicate this COVID-19 so as to make sure that it goes home as it came, to make sure that this virus do not continue, to make sure that this virus goes home as it's just came like that. We believe that coronavirus came as a thief, unexpectedly, just like that. It has just covered the whole world, putting tears in the eyes of people, making people to regret being human beings. So at this point, there are lots of things that healthcare providers has come together to say these are the things that we must do in order to eradicate coronavirus. And we have to start by saying that at first we have to remove fear. We have to remove the fear of unknown. We have to stop this anxiety about coronavirus. The disease has come. This virus is already here. It's all over the world. We have to understand that this virus is the same as any other infection all over the world. We have to accept our situation. We have to say, yes, it is here. Next topic on your mind should be, what are we going to do to stop it? What are we going to do to stop it? Not to continue to be afraid of it. Please, we have to find several ways to solve this problem. And we say the first problem in this coronavirus is fear and anxiety. And the solution we have come today to say is that people should understand, people should accept this condition and be ready for it. People should not be afraid anymore, because the healthcare providers all over the world have found out that lots of patients who have this virus, before they leave their home, they will make some phone calls and say, oh mom, I'm going to the hospital right now. Please, can you take care of yourself? They said I'm positive. It's obvious that I'm very, very sick. So please, can you take care of yourself, mom? I do not know if I will see you again. Why should you say this? Why should you say this to your mother? Because they say you are positive to this virus. That means you are very, very much afraid. And by doing this, your mom, maybe she's hypertensive, she might be thinking about you and your whereabouts, or what will become of you. You say, by doing this, you see, the case continue to multiply. Maybe your mom can run out of the day and say, maybe she's or immunocompromised or something. She will try to see what she can do to help her child, or whatever. When she comes out or do anything on the outside, she might be infected too, and the disease continue to multiply. So we found out that fear and anxiety has caused a lot of harm, has helped to multiply this virus. And today we say that the actual solution, and the first we have to do, is to accept our situation, to accept this condition and be ready to tackle the problem. On the next step, we found out that there are some individuals who have decided to have a negative or have lots of misconception about this coronavirus. They have decided that no matter what the government have to put in place in the name of safety rules, that they are not going to adhere to those strict rules. Some people say that is false, that some people say that's a waste of time. Some other people say that even the vaccine intervention or some of the drugs that we are trying to put in place, they have said that they are not going to make use of it. Some people say they are not going to make themselves available for these medications. Some people say when they get infected that no one should take them to the hospital. You see, by doing this, they still contribute to the multiplication of this virus all over the world. We now say today that people should help us, health workers. We have suffered so much. We have tried to put in our best. All our hands are together trying to eradicate this coronavirus, and we need your help. We need your help in this situation, because this is a biological war that everyone have to be responsible. Everyone have to put his or her hands together to help the healthcare workers. Some individuals have refused, to accept simple wearing face masks. You see, they have refused to do that, because they say it is a virus for the politicians, that a virus will kill politicians and continue to kill them. By believing such, by trying to think of that, before they could know it, they also get infected and continue to infect their family members. We now say that people should please try to remove themselves from this group of people who do not want to, obey the safety rules. That we say that people should adhere to the safety rules, accept this situation. Do not be a party to those who say negative things about the effort of the health workers or the effort of the political leaders who are putting much fund to produce the vaccine, or the other group of people who say that the vaccine is not for them, or the vaccine is not going to be tested on them, or the vaccine, you see, lots of things, lots of misinformations all over everywhere. You see, all these things contribute to the multiplication of this virus, and we say if we want to put it to a stop, if we must stop the coronavirus multiplying, going to infect more people even to the next generation, then we must stop the misinformation, misconceptions, and the negative attitude towards this COVID-19. Okay, and we say that there are some other things that have contributed to the spread of this virus, which include the nonchalant attitude of our people nowadays. You see, lots of people say that they are interested and they are happy over the pandemic virus all over everywhere. They say they are happy, and when you ask them, they say yes, that the disease is meant for the politicians, that the disease should continue to kill those who are too rich, you see. So all these things we say, that is not good. Now, if we must continue to make it, if we must continue to put this COVID-19 to a stop, that we must accept all these situations and be ready to, put some things together, take our corrections, and multiply. So as we are going on, the health workers are pleading to everyone all over the world. We say, please adhere to the strict safety rules, adhere to all these rules and regulations. Please take your drugs if you're infected. If you're infected or if you're sick, please do not come to the public, and people should, avoid all these crowded areas. Do not involve yourself in so many things that can make you to, be exposed to this virus, because at this point, we've not gotten a standard vaccine or a particular drug that can help to, cut down this infection. And we say that please, people all over the world should adhere to these instructions and control their, ways of thinking and the way they relate to other people about something. Lots of people have said that they are not going to accept the vaccine that is on point right now. And we say, how can we help ourselves? If you continue to be the one that you don't want this, so please, why do you disturb other people who want to take the vaccine? Why do you, misinform them about the vaccine that that is not going to do something? So please, we say that people should allow every other person and contribute as you can do. If you have this self-determination that coronavirus must be eradicated, if you tell yourself that this biological war is not only for the healthcare providers, that is not only for the politicians, if you tell yourself that it's for me, it's for my husband, it's for my children, for my family members, for my community, you see, if you say that it's for everyone, that means you must contribute, you must be ready, you must, do the things that you need to do, the way you can do it. You see, you need to contribute in your own little way. You do not relax and say, oh, it is not for me, or you say, oh, I'm waiting for the hospital, I'm waiting for the government, I'm waiting for my maybe friend who is a health worker to do everything for me. So please and please, we say that to eradicate COVID-19 from the whole world, from the faces of the earth, everybody must put hands on deck. And we must not leave any stone unturned. We must do the needful. We must help ourselves. See it as your own problem. See it as your own biological war. Do not leave it to the healthcare workers. Do not overdo things, Do not misinform people. If you are the one doing it, please stop it today. Let us help ourselves and fight this war. Let us see that this war will become a thing of the past. And we believe as health workers that as this war has begun, that so long as it has a beginning, that it will also have an end. At this time we say that before you stop watching this particular episode, and I say that you can as well press the subscribe button and like my channel, so that some of the time that I bring another information like this, it can get to you. Thank you for listening and have a good day.